Southern Luzon State University, College of Allied Medicine, Lukban, Quezon, Bachelor of Science in Nursing Level 2. I'm Jamela Z. E. Ariel from Bachelor of Science in Nursing Level 2, Section B, and today I'm going to discuss about the Leopold's maneuver. For the definition, Leopold's maneuver is a systemic abdominal palpation to determine the position and presentation of the fetus. It is preferably performed after 24 weeks of gestation when fetal outline can already be palpated. Purpose is to determine the presentation, the presenting part where it will exactly lie, and the degree of the descent. Number 2 is to estimate the size and the number of fetus. Nursing consideration. Palpate with warm hands, because cold hands can cause abdominal muscles to contract, and use palms and not fingertips as it may tickle the client. Palpate gently but in firm motion. Materials is drape. Preparation. To prepare the client, the patient should empty the bladder before the procedure. Number 2 is the patient should lie flat on her back with knees flexed slightly to relax the abdominal muscles, or as we call the dorsal recumbent position. Procedure is to greet the client and introduce yourself. Explain the procedure to the client. Place woman in dorsal recumbent position. Supine with knees flexed to relax abdominal muscles. Place a small pillow under her head to promote comfort. Drape client and expose the abdomen from the level of the xiphoid process down to the symphysis pubis. Warm 2 hands by rubbing one against the other before placing them on the abdomen, as cold hands can stimulate uterine contractions. Use the palm for palpation and not your fingers. Perform the 4 maneuvers. During the first 3 maneuvers, the examiner stands at the side of the bed and faces the client, and the 4th maneuver, facing the foot part of the bed. For the first maneuver, fundal grip. Facing head part, using both hands, feel for the fetal part lying in the fundus. Findings should be: head is more firm, hard and round, that moves independently of the body. Breech is less well defined, that moving only in conjunction with the body. Fundal palpation. The uterine fundus is palpated to determine which fetal part occupies the fundus. For the second maneuver, or the umbilical grip, one hand is used to steady the uterus on one side of the abdomen, while the other hand moves slightly on a circular motion from top to lower segment of the uterus to feel for the fetal back and small fetal parts. Use gentle but deep pressure. Findings: fetal back is smooth, hard, and resistant surface. Knees and elbows of fetus feel with the number of angular nodulation. Lateral palpation. Each side of the maternal abdomen is palpated to determine which side is the fetal spine and which are the extremities. Spine feels smooth, curved, and resistant feel. Limbs feel small, knob-like, irregular parts. For the third maneuver, or the Pollex grip, using thumb and finger, grasp the lower portion of the abdomen above symphysis pubis. Press in slightly and make gentle movements from side to side. Findings: if head is engaged, it will not move. If the head is not yet engaged, it is movable. One hand applies pressure on the fundus, while the index finger and thumb of the other hand palpate the presenting part to confirm presentation and engagement. For the last maneuver, facing foot part of the woman, palpate fetal head, pressing downward about 2 inches above the inguinal ligament. Use both hands. Findings: good attitude if brow corresponds to the side of or the second maneuver that contains the elbows and knees. Poor attitude if the examining fingers will meet an obstruction on the same side as fetal back or hyperextended head. Also palpate infant's anteroposterior position. If brow is very easily palpated, fetus is at posterior position, occiput pointing towards the woman's back. The area above the symphysis pubis is palpated to locate the fetal presenting part and thus determine how far the fetus has descended and whether the fetus is engaged. If hands are converging, it indicates disengagement. Disverging indicates engagement of the hip. After the procedure, position the patient comfortably. Then, document the findings.